I'm Dr. Shari Weinberg. I'm a retired pediatrician, but I'm speaking to you today in my capacity as president of the Western Washington chapter of Physicians for a National Health Program. Today's bill, of course, we're in favor of covering everybody in the United States, but meanwhile, we're in Washington State. We think that this bill won't get us there, but it will make some baby steps forward and might provide significant relief right away for some of our state's residents who are currently suffering the most. I'd like to remind you all that the original Canadian researchers sold their patent for the isolation of insulin for $1 to the University of Toronto. And they did that to make the process available to everybody without profiteering. In the century since, that was in 1922, by the way. In the century since, we have certainly lost the dedication to community that this gift embodied. We've also completely lost the concept prevalent in the rest of the developed world that patients are the reason that healthcare systems exist and that the focus must be on how to mobilize society's resources to provide the care that patients need. In that spirit, I testified before you when this was two different Senate bills, that this would be a real positive step. There is one serious flaw, and that is the composition of the work group is way too heavily weighted towards multiple representatives of the insurance industry and no patients whatsoever. Wait a minute, isn't this supposed to be about patients? So anyway, I understand that Representative Marcee is planning to introduce some amendments, or some may have already been proposed, that will reduce the number of insurance folks and add at least one patient with diabetes, at least one physician who knows something about endocrinology, at least one primary care person, and perhaps also a patient educator who works with diabetic patients, that these all should be added with reduction of overrepresentation of those who profit from insulin. So anyway, on behalf of PNHP Western Washington, I appreciate your efforts to do what you can in our state to control outrageous price gouging and complete disregard for the human lives at stake on the part of the pharmaceutical industry and health insurance carriers. But let's not forget, we still need everybody in, nobody out. Thank you very much.
Thank you, Dr. Weinberg. Good to have you back here with us today.
Oh, sure.
Thank you. Good afternoon, Madam Chair, Ranking Member Steve O'Ban, and all the members of the committee. My name is Marcee Stone-Vekich. My husband, Max Vekich, is a former state representative from the original 35th LD, and I'm sure he would love me to say how to pronounce his name. You've heard me speak before. I have testified in support of this bill because I am a mom of Claire Donahue, type 1 diabetic, who is now a healthcare refugee living in the Czech Republic. She was diagnosed at 22, right before she graduated from the Evergreen State College. She was shocked and overwhelmed, but thank God for the Affordable Care Act. She was able to stay on her insurance until she was 26. When she aged out, getting and keeping her insulin coverage became very unpredictable. Many times we helped her pay for her premiums and other expenses. And while on Apple Health, I know that this is something that diabetics have to do. They have to be checked in with their doctor every 3 months. But for whatever reason, the prescriptions were always held up and with the pre-authorization, and it just caused her a great amount of stress. So much so that she started doing research on other countries, what their cost of living was, and most importantly, how they felt about expatriates and could she get affordable insulin. Eventually, it was so tough for her that she did move to a former communist bloc country where the insulin is almost free. It only costs her time away from her friends and her family, who are thousands of miles away. Although I support these bills, I'd urge you to consider lowering the cap to $30. And I'd like to be sure that this cap is also available to the uninsured diabetic. I believe that you want to keep diabetics from rationing insulin. These bills are a big step in the right direction, but the most vulnerable will slip through the cracks, and they may possibly slip from our lives. I'd like to thank you so very much for all the work that you have done on this. It means a great deal to me. Thank you.
Thank you for being here. Thank you for sharing your story. And please tell your husband hello. He and my dad worked together as longshoremen. And Ms. Laws, go right ahead.
Chairman Cleveland, Chair Cleveland, Senator O'Bannon, members of the committee, Cindi Laws with Healthcare for All Washington. We have submitted some amendments to this bill that basically fall under 2 areas. But I do want to point out this bill is an amended version. It did pass the floor of the House 97-1, which is fantastic. But it was minimized. It was taken from using the comparison with 6087 and 6113. It did take away some of the intent and to make it we're going to study this, which is great, but it didn't necessarily call for direct action as 6113 does. So I put in some restoration language there on 2 areas. But to pick up one of the things yesterday that was really powerful on the hearing on 6087 in the House was the number of people that were there who live on insulin and their family members. You had 7 people coming to tears while they were testifying. The young adults in particular emphasized the need for a $30 copay because that was what they could afford. They couldn't even afford the $100 that we're proposing here. And part of the reason that that is not out of line to consider is that in the fiscal notes on this bill, these bills, is that the fiscal notes, according to information from Kaiser Permanente Northwest, the average patient prescription cost that they get under their bulk purchasing ranges from $9.53 for 30 days to $20.88 for formulary insulin. And for Kaiser Pacific Health Plan of Washington, it increases a little bit from $32 for formulary insulin to $79 from non-formulary. So in both cases, it's substantially lower right now. I also want to point out one of the things earlier, one of our other colleagues on the other side of some of these other bills was noting was the rebates and that kind of stuff. And those are, as previously our pharmacist on the Board of Healthcare for Washington, Ronnie Shore, if you recall, testified that those rebates, first off, usually only last for a year. And they are so much burden for those people trying to achieve those rebates that it becomes unattainable. But the bigger issues here is, as Dr. Weinberg noted, and it is the composition of the board. The board, the work group, calls for 1 member from each of the state's insurers. There are more than 25 insurers, well over more than 25 insurers. And you know as well as I do, if you have a work group with that many people on one side, and that very group has been the one preventing people from attaining affordable insulin and anything else, it's not going to be a good outcome. So we did put in there, and I want to make another case on this one. When it comes to having people who have diabetes or any other health condition and or members of the general public, I want to point out The state has boards and commissions. You all know that. We have boards and commissions, we have work groups, and everything from the Anonymous Fish Commission to the Wolf Advisory Group has 2 or more members of the general public. Specifically, the Pharmacy Commission has 13 members, 4 of which are general public members. The Chiropractic Commission has 14 members, 3 of which are general public. And the Dental Commission has 14 members, 2 of which are the general public. If it's good enough for fish, and it's good enough for wolves, and it's good enough for actual medical providers, it sure as heck should be good enough for this work group. So please take our amendments into serious consideration. Thank you again. This bill and all the other insulin bills that Senator Kaiser and you have introduced and co-sponsored are going to make a tremendous value difference in people's lives. They will save lives. Thank you for that.
Thank you, Ms. Laws, very much. Thank you to each of you for being here. Thank you. And Senator